Imagine waking up in the Middle Ages with a fever, your skin is burning, your body is shaking, your family does not know what is wrong. There is no hospital nearby, no antibiotics, no modern surgery, no accurate understanding of infection, no doctor who can truly see what is happening inside your body. Instead, someone might bring herbs. Someone might call a priest. Someone might tell you the air is poisoned. Someone might say your body is out of balance. And if a physician is called, his first solution might be to open your vein and let the blood run out. In the medieval world, sickness was not just painful, it was terrifying. Because the cure could be almost as dangerous as the disease, a wound could rot, a fever could be blamed on bad air, a toothache could become deadly, a childbirth could turn into a funeral, a plague could empty an entire street before anyone understood why. And the people trying to help you were often working with a mixture of observation, religion, superstition, ancient theory, and desperate hope. Medieval medicine was not pure ignorance. Some healers were skilled, some remedies were useful, some surgeons were brave and practical, some midwives saved lives, but they lived in a world without germ theory, anesthesia, safe surgery, blood transfusions, x-rays, antibiotics, or modern anatomy. They were fighting invisible enemies with tools they did not fully understand, and if you became seriously ill, your survival could depend on your wealth, your location, your healer, your family, your faith, and luck. This is the dark truth about medieval medicine. To understand why it was so frightening, we have to start with the ideas that shaped it, and one of the most powerful ideas was completely wrong. For much of the medieval period, educated physicians relied on ancient medical theories passed down from Greek and Roman writers. The most famous was the theory of the four humors. According to this belief, the body was governed by four fluids: blood, phlegm, yellow bile, and black bile. Health meant these fluids were balanced. Illness meant something had gone wrong inside the body. A fever, a cough, a headache, sadness, anger, weakness, swelling, or strange behavior could all be explained as an imbalance. The physician's job was to restore order. To medieval doctors, this system seemed logical. It gave them a way to classify illness. It gave them a reason for symptoms. It gave them treatments to follow. But the problem was simple. The theory was wrong. And wrong ideas become dangerous when people trust them completely. If the body was believed to have too much blood, the solution might be bloodletting. If the body was believed to contain harmful material, the solution might be purging. If illness was thought to come from bad air or imbalance, the treatment might ignore the real cause entirely. A patient with an infection did not need to be weakened. A patient with severe illness did not need to lose more fluid. A patient already close to death did not need a confident physician applying the wrong cure. But in the medieval world, confidence often looked like knowledge, and that made medicine dangerous. One of the most feared treatments was bloodletting. The idea was simple. If the body was out of balance, remove blood to restore it. Sometimes this was done by cutting a vein, sometimes by using leeches, sometimes by choosing a specific part of the body based on the illness, the season, or the physician's belief about which area needed relief. To modern ears, it sounds horrifying, but to many medieval healers, it was normal. A sick person might be seated near a fire or laid on a bed. A bowl would be placed nearby. A sharp blade would be prepared. The physician or barber surgeon would open the vein, then everyone would watch the blood leave the body. The patient might already be weak, already feverish, already terrified, but the treatment demanded more suffering. If too much blood was taken, the patient could faint. If the cut was dirty, infection could begin. If the illness was already severe, the bloodletting could push the body closer to collapse. Leeches offered another version of the same idea. They were placed on the skin to draw out blood more slowly. To a frightened patient, the feeling of living creatures attached to the body must have been disturbing. But leeches were not seen only as disgusting. They were medical tools. They were part of a trusted system. That is what makes bloodletting so dark. It was not always done by fools. It was often done by educated people following the best medical theory they had. A wrong theory, repeated for centuries, could become respectable, and a respectable treatment could still kill. But most people in the Middle Ages did not have easy access to trained physicians. Doctors could be expensive. They were more common among the wealthy in cities, courts, monasteries, and noble households. Ordinary people often turned to local healers, midwives, monks, wise women, family remedies, apothecaries, and practical knowledge passed down through generations. This kind of medicine was not always bad. In many cases, it was the most useful help available. Herbal remedies could soothe pain, some plants could calm the stomach, others could help with sleep, some could reduce inflammation. Honey could be used on wounds and could sometimes help. Wine or vinegar might be used to clean injuries. Splints could support broken bones. Rest, warmth, food, and care could give the body a chance to recover. There were medieval healers who observed carefully. They knew what had worked before. They learned from experience. They understood that some plants helped and others harmed. But the danger was always there. The wrong plant could poison someone. The wrong dose could make a patient worse. A remedy that helped one illness might do nothing for another. And without modern diagnosis, people often did not know what they were really treating. A cough might be harmless, or it might be the beginning of something deadly. A rash might fade, or it might spread. A stomach pain might pass by morning, or it might be a sign of something no medieval healer could fix. In that uncertainty, every home became a place of waiting, a mother mixing herbs, a father standing near the doorway, a child burning with fever, a healer whispering instructions, a family wondering whether the remedy would save the patient or whether they were watching the beginning of death. But medieval medicine did not only treat the body, it also treated the soul. Religion was central to medieval life, so illness was often understood through faith. Sickness could be seen as a test, a warning, a punishment, a spiritual attack, or a sign that something was wrong beyond the physical body. A sick person might receive herbs and prayer at the same time. A priest might be called alongside a healer. A family might pray to a saint. A patient might confess sins. A relic might be touched. A pilgrimage might be promised if healing came. For many medieval people, this was not separate from medicine. It was medicine. The body and soul were connected. If the body was suffering, the soul might be in danger too. This could bring comfort. A priest could calm a dying person. A prayer could give meaning to pain. A community could gather around the sick. But it could also bring fear and shame. If sickness was connected to sin, people might wonder what the patient had done. If a disease was visible, strange, or frightening, it could lead to suspicion. If someone behaved unusually, others might see not illness but spiritual danger. And when a community is afraid, compassion can quickly turn into blame. This became especially dangerous during epidemics. Because when disease spread through a town, medieval medicine often had no real answer. People could see the results: the fever, the swelling, the coughing, the weakness, the dead. But they could not see the cause. They did not understand bacteria or viruses. They did not understand how many infections truly spread. So they searched for explanations: bad air, corrupted smells, the position of the stars, divine punishment, sin, outsiders, enemies, poison. Rumors moved almost as quickly as disease. During plague outbreaks, fear could take over entire communities. Streets that had been noisy could fall silent. Doors could be marked by sickness. Families could shut themselves inside. The wealthy might flee to the countryside. The poor might be left with nowhere to go. Church bells could ring again and again. Bodies might pile up faster than they could be buried, and the healers themselves could die. Imagine a town during a deadly epidemic. A man wakes with fever. By evening, he is worse. By morning, another person in the house is sick. A neighbor refuses to enter. A priest is called. A healer burns herbs or recommends avoiding foul air. Someone whispers that the sickness came from sin. Someone else blames strangers. People begin to avoid one another. The disease does not only attack bodies, it attacks trust. In the case of the Black Death, the scale of death was almost beyond imagination. Entire communities were shaken. Families were destroyed. Labor systems changed. Faith was tested. Some people prayed, some fled. Some cared for the sick, and some abandoned them. Doctors and healers tried what they could. They examined urine, checked pulse, recommended diet, used bloodletting, burned aromatic substances, suggested fresh air, or advised escape. But against plague, most treatments failed. That was the nightmare. Not just that people died, but that they died while everyone was still guessing. When medicine cannot explain suffering, panic fills the space. But disease was only one part of the medieval medical world. War created another kind of horror. Battlefield medicine was brutal because medieval weapons did brutal things to the body. Swords cut, arrows pierced, spears drove deep, axes split flesh and bone, maces crushed, crossbow bolts punched through armor and muscle. Fire burned, stones shattered limbs. A battlefield after combat was not clean or heroic. It was screaming, mud, blood, broken bodies, torn clothing, and men begging for help. A wounded soldier might be dragged away with an arrow buried in his thigh. A knight might be pulled from the ground with a crushed arm. A peasant fighter might lie with a deep cut across his stomach, and if he was lucky, someone with experience might try to save him. The people treating these wounds were often barber surgeons, military surgeons, monks, or practical healers. Some were skilled. They could remove arrows, set bones, stitch wounds, apply bandages, cauterize bleeding, use wine or vinegar to clean injuries, and amputate when there was no other choice. But every treatment came with pain. There was no modern anesthesia. A patient might be held down by other men while a surgeon worked. A knife could enter already damaged flesh. An arrowhead might have to be pulled or cut out. A wound might be burned closed with hot iron. A broken bone might be forced back into place. The patient might bite leather, scream, faint, or pray. And surviving the procedure did not mean surviving the wound. Infection was waiting. This was the silent killer after the violence. A man could survive the sword blow and die days later from fever. A wound could swell, the skin could darken, pus could form. The smell could change, the patient could become delirious, the body could turn against itself. Without antibiotics, infection was often more frightening than the original injury. Battlefield medicine was a series of impossible choices. Leave the arrow in and the man may die. Remove it and he may bleed to death. Cauterize the wound and the pain may be unbearable. Do nothing and infection may take him. Amputate and the operation itself may kill him. Amputation was one of the most terrifying possibilities. If a limb was crushed, rotten, or too badly damaged, cutting it off could be the only chance. The surgeon had to move fast, the blood had to be stopped, the patient had to survive shock. Then, if he lived through the cutting, he had to survive the days after. A lost limb also meant a changed life. For a knight, it could mean the end of fighting. For a laborer, it could mean the end of work. For a poor family, it could mean hunger. Medieval medicine could save the body and still destroy the future, but some of the most dangerous medical moments did not happen in war. They happened in the home. Childbirth was one of the greatest dangers of medieval life. It was common, expected, essential for family, inheritance, and survival, but it was never safe. A woman giving birth entered one of the most dangerous experiences of her life. Midwives were essential. They carried practical knowledge. They supported mothers. They helped deliver children. They knew what had worked before, but they worked without modern surgery, antibiotics, blood transfusions, safe pain relief, or emergency medicine. If labor went normally, the mother and child might survive. If something went wrong, the room could become desperate. The baby might be positioned badly. The labor might last too long. Bleeding might not stop. Fever could come after birth. Infection could set in. The child might die. The mother might die, or both. Imagine a candlelit room. Women gathered around the bed, a midwife speaking calmly even as the situation worsens, the mother exhausted, the family waiting outside, a priest nearby just in case the moment of birth becomes the moment of death. For noble women, childbirth carried political weight. A baby could secure inheritance, a son could protect a dynasty, a failed birth could change land, power, and alliances. For peasant women, childbirth carried survival weight. A mother's death could leave children without care. A newborn's death could crush a family, and the danger did not end when the baby was born. Postpartum infection could kill days later. Heavy bleeding could take a life quickly. A fever after birth could turn joy into mourning. Childbirth was not a rare medical crisis. It was a repeating danger built into ordinary life. Every family knew it, every woman faced it, and medicine could only do so much. Then there were everyday medical risks, the small problems that could become nightmares. A rotten tooth, a cut hand, a burn from the fire, a broken finger, a badly infected foot, a cough that would not stop, a sore throat, a stomach sickness, a fall from a horse. In the medieval world, minor injuries could become major threats. Dental problems were especially brutal. A toothache was not just discomfort, it could become agony. A rotten tooth could infect the gum, the face could swell, the pain could spread, fever could follow, and if the infection moved deeper, the danger could become serious. Treatment was often crude. A tooth puller or barber surgeon might remove the tooth with force. No modern numbing, no precise dental instruments, no clean dental clinic. The patient might sit in a chair while the tool gripped the tooth. Then came the pull. If it worked, the tooth came out. If it failed, it could break. The gum could tear. The pain could continue. The infection could worsen. A problem that modern dentistry might solve in one visit could become a medieval ordeal of pain, fear, and blood. Everyday wounds carried the same danger. A farmer cuts his hand on a tool. A cook burns her arm. A child falls and opens a wound. A worker steps on something sharp. At first it seems small, then the wound reddens, then it swells, then the fever starts. Without understanding germs, people could not fully understand why some wounds healed and others became deadly. They could clean, wrap, pray, apply herbs. But sometimes the body still failed. Mental illness and misunderstood conditions brought another kind of danger. Medieval people did not understand the mind the way we do today. Seizures, hallucinations, deep sadness, confusion, trauma, unusual behavior, or emotional collapse could be explained through spiritual, moral, or supernatural ideas. Some sufferers received care, some were protected by family, some were brought to religious places for help. But others were feared, mocked, hidden, restrained, or blamed. A person who behaved strangely could be seen as cursed, possessed, sinful, dangerous, or touched by forces beyond human understanding. To be sick in a way others could not see clearly was frightening, because the problem was not only the illness, it was how people interpreted it. A broken bone could be understood, a bleeding wound could be seen, but a mind in distress could become a mystery, and in the medieval world, mysteries often attracted fear. Still, it is important not to imagine all medieval healers as foolish or cruel. Many were trying to help. Many observed carefully. Many learned from experience. Monasteries preserved medical texts. Midwives developed practical knowledge. Herbalists understood plants. Surgeons learned from war. Physicians studied the best authorities available to them. Hospitals existed in some places, often connected with religious care. There were real efforts to reduce suffering. The tragedy is that medieval medicine was trapped by the limits of its time. It had pieces of truth, but not the whole picture. It could treat some symptoms, but not many causes. It could help some wounds, but not stop many infections. It could comfort the dying, but not always save the living. And your access to care depended heavily on class. A wealthy noble had more options. They could summon a physician, buy imported medicines, rest in a warm room, receive better food, leave a plague-stricken area, pay for personal care, recover in cleaner surroundings. But wealth did not create modern medicine. A king could still die from infection. A queen could still die in childbirth. A lord could still be helpless against plague. Money could buy attention. It could not buy certainty. For the poor, sickness was even more dangerous. A peasant who became ill might not simply suffer physically, they might lose income, miss work, fail to harvest, fall behind on rent, leave children hungry. A wound could mean poverty. A fever could mean debt. A disabled body could threaten the survival of the entire family. Poor people might delay treatment because they could not pay. They might rely on whatever help was nearby. By the time a healer was called, it might be too late. Medieval medicine, like medieval justice, was shaped by power. The wealthy suffered with more comfort. The poor suffered with fewer choices, and yet no one was truly safe. That is the most haunting part of medieval medicine. It lived in uncertainty. Every illness became a question. Would the fever break? Would the wound rot? Would the bleeding stop? Would the baby survive? Would the tooth come out cleanly? Would the plague pass by the house? Would the healer help or harm? Would prayer bring comfort? Would the cure be worse than the disease? Medieval people were not stupid, they were afraid. They were trying to survive in a world where the body could fail suddenly and medicine could only reach so far. They used what they had: herbs, knives, leeches, fire, bandages, prayer, ancient texts, experience, hope. Sometimes those things worked, often they did not. And when they failed, people did not always know why. That is why medieval medicine was so terrifying, not because every remedy was useless, not because every healer was dangerous, not because every patient died, but because no one could be certain what would happen next. A respected treatment could weaken you, a small wound could kill you, a childbirth could become a funeral, a toothache could become a crisis, a plague could turn a town into silence. A healer could save your life or bring you closer to death while trying. So the next time you imagine a medieval healer standing over a patient by candlelight, do not picture only superstition. Picture uncertainty, a body burning with fever, A family waiting in fear, a bowl ready for blood, a bundle of herbs on the table, a priest murmuring prayers, a surgeon sharpening a blade, a soldier biting down while iron touches flesh, a mother struggling through labor, a town listening to bells for the dead. This was medicine before the invisible world was understood, before pain could be safely silenced, before infection could be fought properly, before a patient could trust that the cure would not destroy them. In the Middle Ages, sickness was a doorway. On one side was recovery, on the other was suffering, fear, and death. And too often, no one knew which side the patient would reach. That is the dark truth about medieval medicine.